Medicare plans. Today we are going to talk about Medicare and the different plans we have to help senior citizens. This will be a training on the basic topics. First of all, what is Medicare? Medicare, as you are seeing on the screen in the presentation, is the federal health insurance program that helps senior citizens, that is, people over 65 years old, certain younger individuals with disabilities, those to whom Social Security or the government grants this Medicare benefit, and people who have end-stage renal disease. As we already mentioned, this is a benefit granted by the government. It is not something that a person can simply apply for and receive right away. The government must approve it if certain criteria are met. The original Medicare card, which is the one issued by the government, is the one you see on the screen. It has blue, white, and red colors. As you can see, it has the person's name at the top, and below that, the Medicare number. On the old cards, which can no longer be used, the Medicare number used to be the person's Social Security number with an additional digit at the end. The new numbers, as shown on the screen, contain a combination of letters and numbers. It is very important to always use the number from the new card and not the old one. As you can see, the card also indicates Part A and Part B. Part A covers everything related to hospitalization and hospital-related services. It has an 80-20 coinsurance. The plan covers 80%, and the patient would be responsible for the remaining 20%. Part B covers services related to medical care, such as primary care doctors, specialists, and other medical procedures. Also, on the right-hand side of the card, you will see the start date of the coverage or benefit being granted by the government. That date is very important because individuals can enroll up to 3 months before turning 65. However, the effective date must always be on or after the date when the coverage begins for both Part A and Part B. What does original Medicare cover? What's the difference between original Medicare and the plans we sell? And why should you sell the plans we offer? First of all, as we previously discussed, original Medicare only covers the medical part, Part B, and the hospital part, Part A. It only includes primary care doctors, specialists, and hospital services. It does not cover prescription drugs, Part D, vision, dental, transportation, or any of the other services that we know our seniors need because they are vital for their health. As a person ages, their need for medical treatment increases significantly. As we mentioned, original Medicare has coinsurance. For example, Part A has an 80-20 coinsurance, which means that the individual is still responsible for 20% of the cost of the hospital procedures they undergo. To cover that 20%, there is something called Medicare Supplement, which is what you see in the middle line. These Medicare supplements are private plans, and they also come with a monthly premium. Why do I say also? Because Part B of original Medicare also has a cost. The government charges the beneficiary a monthly premium, which is approximately $178, deducted directly from their retirement check. So, in addition to that monthly premium charged by the government, if a Medicare supplement is added to help cover the 20% coinsurance, plus the copays and coinsurance from Part B medical services, the person would also have to pay an additional premium for the supplement. Medicare supplements are more suitable for a specific type of client, such as someone who needs to see a different primary care doctor in every city, someone who travels a lot, someone who has enough money to pay both premiums, the Medicare Part B premium and the supplement premium. But we can agree that most people, when they reach retirement age, do not have the financial resources to cover so many expenses. The average retirement income is about $800 to $1,000 per month, and from that amount, they have to pay rent, gas, car, insurance, among other expenses. There's not much left to cover additional costs. Paying $178 per month for Part B, plus the Medicare supplement premium, represents a fairly high cost for a retired person. In addition, Medicare is mandatory for these individuals, which means they must pay those $178 per month no matter what. What do we mainly sell? We mainly sell Medicare Advantage, which is the column you see on the right in orange. In this column, we see what Medicare Advantage covers. Medicare Advantage covers hospital and medical care, just like original Medicare. Because by law, Medicare Advantage plans also known as Part C, are required to cover these two things. In addition to that, they also include coverage equivalent to what a Medicare supplement offers, meaning they cover the 20% coinsurance and the co-pays and coinsurance that also applied under Part B. And on top of that, they cover prescription drugs, that is Part D, which includes all medications. They also cover extra benefits. These extras shown in the chart are known as sweeteners. These sweeteners are the benefits that differentiate one plan from another. They are additional benefits that the plans offer to make them more attractive and useful for certain types of clients. Each plan is tailored to the specific needs of that client. For example, there are plans that include unlimited transportation for people who cannot drive or who do not have their own transportation. There are plans that offer unlimited dental coverage for those who need to get dentures. There are plans that provide food cards for people with low financial resources who need additional support. Most plans cover gym memberships for senior citizens. Some plans offer glucose monitoring devices or emergency devices to quickly call 911 in case of an emergency. There are many different benefits. That is why we mainly sell Medicare Advantage. In most cases, people hardly have to pay a premium or even zero premium. That means many of these plans have zero premium, meaning they would not have to pay any additional cost to get these extra benefits. Why does this happen? Because the United States government, which is the entity that provides Original Medicare, wants to remove the financial responsibility in the event of a major medical claim. For example, if a person has Original Medicare, which operates under an 80-20 coverage model, and they have a hospitalization that costs $1 million, the government would have to pay $800,000, which represents a very high financial risk. What does the government do to mitigate that risk? The government prefers to pay a specific monthly amount to a private Medicare Advantage plan, making that private plan responsible for the person's medical care risk and for any medical claims that may arise. That's why these Medicare Advantage plans have no premium and cover all these benefits, because the government pays these private companies monthly so they can assume that risk. Likewise, if the person has Medicaid, it's important to understand the difference between Medicare and Medicaid. Medicaid is financial assistance for people with low income. Medicare, on the other hand, is medical care for people who need specific medical attention, whether because they are over 65 years old, have reached a certain age, have a disability, or suffer from end-stage renal disease. This distinction is important. Why? Because many people confuse the two, especially within the Latino community, since the words are so similar. But Medicaid is for people with low income. Medicare is for people who need specific medical care. Now then, what happens? There are many people who, when they turn 65, meet both requirements. They need medical care because they are senior citizens, and they need financial assistance because their retirement income, as we mentioned before, is not enough for anything. These people who have both Medicare and Medicaid receive help from both programs, or they have LIS, low-income subsidy, which is state assistance to help cover the cost of medications, mainly. These types of assistance are granted based on income at the state level. What happens when a person has this state-based income assistance? That state assistance pays the Part B premium. Why? Because if the person does not have that assistance, when you enroll them in Medicare Advantage, they would still have to pay the Part B premium. They wouldn't have to pay anything for the Medicare Advantage plan itself, but they would have to pay for Part B if they don't have that state-based assistance. If the person does have that state assistance, number one, it helps pay the Part B premium. Number two, it increases the benefits offered by the Medicare Advantage plan. Why are the benefits increased? Because now there is funding available from both the federal government, Medicare, and the state government, Medicaid. That means that by having funds from both sources, there is more money available to provide greater benefits to the patient. Who is eligible for Medicare Advantage? People who have both parts, Part A and Part B, are eligible. We will find patients who only have one of the parts, for example, only Part B but not Part A, and those patients cannot enroll in Medicare Advantage until the government grants them both parts and they live within the plan service area. Why is this important? Because these plans are regional. either by counties or by states. For example, there are plans like Peach State Health Plan, which is a PPO and is available throughout Florida. There are other plans like some HMOs, some POS plans, and many PPOs that are more limited by county. If the person lives within the service area of the plan and has both A and B, they can qualify for any Medicare Advantage plan, depending on the company they choose, the benefits they need, and the plan that fits them best. So what is important to keep in mind when starting in this Medicare Advantage business? How does Medicare Advantage sales work? Number one, it is important to build a referral network with primary care doctors and specialists. As we see in the graph, 93% of people who were on Medicare did not want to change their primary care doctor. 87% did not want to change their specialist. They didn't even think about it. We're talking about a 93% and an 87% retention rate. Who controls the patient? The doctor controls the patient. Who is the tangible part of the health insurance? The doctor. We, as insurance agents, sell an intangible product. The person cannot touch the insurance, but they can touch the doctor. They have the doctor right in front of them. That tangible part, the doctor, is the one who controls patient retention and often directly influences which insurance the patient will have. That's why it is vital that we work very closely with specialists and primary care doctors. Another important reason to sell Medicare Advantage. Approximately 10,000 people retire every day in the United States, and of those 10,000 people, 19% retire daily in Florida. We're talking about 1,900 people a day who turn 65 in Florida alone. Across the entire United States, that's 10,000 people every single day. There is a huge market, a huge lack of knowledge in the market, and a huge need for what we do and the education we provide.